Do you have any pain in your body? I'm talking about the kind of pain that you think twice before you move. You go to the doctor and the doctor gives you medication, doesn't tell you maybe there is a reason why you have inflammation, but instead of changing your lifestyle or changing your diet, changing your life, or maybe introducing you to something gentle, they give you medication. That medication at first may help you, but then it creates three other symptoms. You go back and you're told, well, this is the pain you're going to have to live with. This is it. I can give you stronger medication. Next thing you know, your digestive system is not working. Maybe you're even addicted. You go back again and say, I really need to do something about this. They'll do surgery. They'll create more pain in your body. It's a really vicious cycle. Sometimes you just don't know what to do. But as you know, in the classroom, we talk about natural healing, different ways to allow the body to heal. But if you say that to someone and you go to the doctor, they'll tell you sometimes, hey, the pain must have been all in your head if you're feeling better. Well, if any of the things that I just said resonate with you, please know you're not alone. There's a lot of people that have experienced pain, and the doctors can't explain why you have pain. However, they're very happy to give you medication. Well, today we are in luck because in the classroom, we're going to talk with Dr. Zulia Frost. Now, she is a physician, an MD, who is fully accredited as a doctor of Chinese medicine and acupuncture. And she is going to be able to share her story, her healing journey, and what made her go from one extreme, medically trained, classically trained, to look at other alternatives that are gentle on the body and have even better outcomes and many times, many times. And believe me, I experienced it. I will share my story with you along with Dr. Zulia, who's in the classroom today. And I'm really excited that I'm going to tell you, so excited to go get your pen, your paper, because we're going to learn and grow together.
And when you need a friend, you can count on me. I'll be right here waiting for you.
Hi, my name is Lily McDermott, and I am a certified life coach, a certified holistic cancer coach, and the host of The Classroom. If this is the first time that you've come to the classroom, please know I've been waiting for you. This is a safe place where you can go when you need a friend. It is my commitment to provide natural ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening, as well as my viewing friend, will feel empowered to embrace inner truth and live the life of your dreams. Well, as you know, many years ago, I started a journey called The Radio Show here, the Lillian McDermott Radio Show. And it was all about allopathic medicine, the latest in technologies and all of that. But something happened along the way. I started meeting people that were treating their body naturally, that they were doing things that were beyond what I've ever been taught or told. I was told, take the pill and the pain goes away. Take the pill and the cold goes away. But then all of a sudden, teacher after teacher after teacher presented themselves. And then I started my journey of transformation that led me to frequency. And as you know, for 5 years, I brought this frequency to doctors, saw miracles. But until I was in a car accident myself in 2017, I didn't realize how much pain I'd never felt pain like this before and how much the pain was alleviated from these frequencies. And now I'm a born again frequency believer. It's how simple it happens. And you don't understand it until you need it. And so today's teacher probably has a very similar journey of pain and awareness. And she is here today, Dr. Zulia Frost. Like I said, she is a fully accredited doctor of Chinese medicine and acupuncture. But prior to that, she was a medical doctor focused on pediatrics. And since it is our sole purpose in life to give and receive love and knowledge, I am so grateful that Dr. Julia Frost is here to do just that. Welcome to the classroom. I'm so grateful to introduce you to all my friends.
Thank you so much, Lillian, for inviting me. I'm really thrilled to share with my personal experience. And I would like to people to learn that there are some other ways to deal with your health, not just pills. I was just listening your story, and I was just fascinated. How similar is it to me?
When I researched you, when I first learned about the FlexBeam, the first thing I said is, I want to find out a little bit more about Dr. Zulia Frost because I had never learned about you. But it was so amazing how many of the same people we knew when we first met one another. And I grilled her, and I just want to tell you the product that we're going to be talking about. I'm so excited to share this with you. It's called the FlexBeam. And I've been using this for now about a month. I've just been excited, actually, maybe less than a month, but I've been excited about the results, and I'm going to be sharing these results. And I'm gonna turn this on. Let me see if I can turn it on so you can see it a little bit. But Dr. Zulia Frost has been very instrumental in this. So look at how the color red. We're going to be talking about red light therapy. We're going to be talking about, let me just turn this off. We're going to be talking about red light therapy and the frequencies that the FlexBeam does. So before we get started, share a little bit about your background. Thank you so much for being in the classroom today. So thank you.
Sure. I want to share, it's really kind of sacred for me. This is the journey which I found late in life, that many people, when they go through some misfortune, it actually works to enrich your sort of soul journey, and you start seeing world different eyes. And like you, I was involved in a car accident as a young person, and I experienced tremendous trauma. And when you said I felt so much pain like I never before, that is exactly. And my biggest motivation in life ever after was to help people to avoid to be in so much pain, because I could not tolerate seeing people in pain. I would always want to somehow help and do it, because my personal experience was so tremendous. After the car crash, I had 3 spinal injuries, paralyzed, and mess, absolutely mess. And after being a doctor, when you suddenly find yourself in the place of a patient, then you see things very differently. I wanted to do my own healing in a way so I would heal naturally, because being a doctor, you also understand that every medication comes with price. Like we were discussing side effects. Yes, there are for one medication, maybe other side effects. And being aware of that, I didn't want to pollute my body too much. So I was looking for natural ways, encourage my body to heal naturally. And the first, of course, there was lots of stretching exercises, deep breathing. And then intuitively, I kind of went into nature. I was doing runs, saluting to sunrise, sunset, receiving this healing red lights which come in from the sun. And eventually I was embracing technology. So this technology, the frequency technology you mentioned about, was also instrumental in my recovery, and that kind of changed my life path. And once you see that something is working for you so well, there is no ways to keep the gin in a bottle. You want to let it out. You want to tell everybody, look, there are some other ways to manage your health, to manage your pain. So this was my first encounter as a practitioner, as a patient, with alternative aspect of medicine. And of course, when I was in this recovery, there was time. I mean, many of you much younger, you don't know, but in my time, there was huge interest in Oriental medicine. There was interest in the concept of acupuncture. It was like, ooh, meridians was something like mysterious and chi. Oh my God, you can just generate chi by doing qigong or tai chi exercises. And I was curious, like everyone in my time, and I went to study this because to me this is also a path which explains how energy circulates in the body. How do we generate this energy? I mean, simple just learning about cellular respiration on biochemical processes was not enough for me. So in a sense, in my journey, I went through this transformation, and every time I step out, I see more wider world of knowledge. I studied shiatsu, I studied, massage, I studied different aspect of energy healing. But then from the scientist in me kicked in because I wanted then to understand what is scientific background of this. So in this case, through my research, I came across of Dr. Weber Institute. And Dr. Weber was one of the first physicians in Germany who set up institute around photobiomodulation. And photobiomodulation is basically a simplistic word to describe treatment with light, but very low intensity light when you just coax the body towards healing. And in my journey, I started with photobiomodulation, lasers, and then eventually I came to LED devices and using a variety of therapies like neuromodulation, neurostimulation, bioresonance, you name it. So now I'm just so enjoying to give that variety of 360-degree health view to my patients.
Yeah, I'm curious. How old were you when you had your car accident? Were you already a medical doctor?
Yes, yes, I was a doctor. And to be honest, it's very interesting what's happening. Your brain blocks that memory. So when I look back, I kind of think it was 30 or 32, something like this. I cannot even pinpoint the day when it happens. To me, that was a very bad time and it locked somewhere in my subconscious mind.
Yes, and so did that create any paralysis? When you say you were in a lot of pain, how much um, how much limitation did you have in your body?
Well, pretty much a lot if you can't move. Yes. And I remember being in the hospital looking at people walking in and out of the hospital. And I was looking and with tears in my eyes, I was thinking, you don't understand how lucky you are. You can walk,
Yes.
walk. And, you know, that was my ultimate, and I love dancing. So my ultimate goal was to dance. And I would dance in those beautiful shoes, which I started before getting into accident. So, great motivation. I made a full, uh, to the recovery to the point you can function well in 7 months.
Wow, wow.
Being paralyzed, yeah.
Yeah, because I was told I was surgical. They wanted to do a fusion C4 through C7. I had herniations, and I remember 3 months prior to the accident, I had been invited to attend a class for Avasia. We would talk to you, and I had talked that you know Tim Smith, the inventor of the product, and that you have been um, helpful in the process of Avasia as well. That 5 years prior to that, I was bringing this modality, this healing modality, to doctors. I was bringing this to them and saw miracles. But I had never experienced pain before. Had you experienced pain before that car accident?
Not in the extent like I had, no,
Yes.
absolutely no way. I mean, I couldn't sleep for 2.5 weeks at all,
Hmm.
being absolutely medicated to my ears with narcotics and everything. It did not even touch the surface of my pain. That's how it was. It was absolutely torturous. I would
And
never want anyone to have it.
exactly. And I understand that there's a pain. I understand that pain is real. But I had not experienced it until 2017. But but I had seen the miracles. 3 months prior to my car accident, I bought my first Avazia unit, which if you guys are interested in it, you can go to whenyouneedafriend.com to my Shop Now bag and learn about it. But let me tell you, the doctor wanted to give me oxycodone, and I said no. I said no because you hear about these reports. And by then, I had already started this natural journey, and I wanted to see if I could heal my body with Avasia. And so, my doctor, who was a neurosurgeon, one of the best in Orlando, he said, then let's do it because he knew that if I had surgery, that he would medicalize me, basically. You can't take out what you put in. So he was more than happy to wait with me, to wait it out. And the miracle I experience, I'm sure is nothing compared to the miracle you experience. Now, did you have to have surgery? Did you have to have any of that? Or were you able to work little by little to get to where you're at today?
Well, lucky to me, I had an amazing, amazing, amazing neurosurgeon who was actually a friend of mine
Similar.
before I got in the accident because I was admitted in my own hospital where I used to work.
Mhm.
And he said, look, you're young, you can heal yourself, or you need help, but you can heal yourself. And thankfully, there was no surgical intervention. He was like remarkable. And he used to give me tasks like 1,000 sequences a day. And I'm and to only do 10 with tears in my eyes. He was really motivating, good. But yeah, and again, I understood if I go surgical route, what could happen?
Yes.
Scars, post-surgical scars, which could be
Hmm.
even worse. They could, that scar tissue can sit on the nerve and give you severe neuropathic pain. And then you end up like the whole body is burning and flame of pain. So no, I wanted to recover naturally.
And that's our similarities, although our accidents were different. Yours was different than mine, but still the similarities. When I sat and to speak with you, because I wanted to meet you before even trying the product and research you before even bringing you in the classroom, because I'm very careful of who comes on. I have to be sold on the product. If not, it's nice. And we even said that I'm going to try it. I even said it to Alessandra. I said, if I get the product and I don't like it, please know we're not going to do anything further. But I love FlexBeam. But I want, before we get to FlexBeam, I do, and by the way, you can go to my website and get a really nice deal during the holidays because why not give the gift of health to your family and friends? But what I want to first talk about is the opioid addictions, the addictions, and what you had just mentioned, the scar tissues. And that was the question that I asked Dr. Razak at the time. I know him. He was my first client when I started my marketing company. And I said to Dr. Razak, can you guarantee me if you do surgery on my neck that I will feel better than I do right now? And he said, I cannot guarantee you that. And he goes, you know that, Lily. And I said, I know that. I know that, but I wanted to hear it from you. Because maybe it was another doctor that couldn't guarantee it, but the best doctor, the best neurosurgeon, he couldn't guarantee it either. So I want to make this claim right now that when we do surgery, there are other things, other consequences to surgery too. And one of them is scar tissue. So let's talk about scar tissue. And when you have a trauma, there is scar tissue. So let's talk about scar tissue and how it creates impedances in the body and could create pain as well.
Yes, scar tissue is a big issue, particularly in surgical circumstances, because you introduce a fresh trauma, fresh injury. So when you do the fresh injury, of course, what is happening? The body start the process healing, which typically consists of 3 stages. First stage, inflammation, where the body sends blood and lymph to this area because you really need to be bathing cells in the healing nutritions and healing oxygen, which is delivered by blood. Then second stage, it's a scar formation, which in essence, it's a scaffolding, which you kind of create where the body can integrate those broken tissues. But of course, this scaffolding is made out of fibrin, really like coarse, hard protein, which make these crisscross bridges. And then it's temporary. It's in the body. It's normally is temporary. But very often what's happened when the body is stuck in this phase of creating scar tissue, scar is not resolving. And then what you have in the actually site of injury, you have like a ball of scar tissue. And this could create an extra compression. It also blocks the energy circulation in the body. It blocks blood circulation in the body. It can compress on blood vessel, and blood is not reaching this area. So you're never gonna complete that healing process. Healing process normally completed once after scaffoldings are formed. Then the body start remodeling this and send these cells, which physically crawl like little amoebas. They crawl on the scaffolding, they settle there, and they create life, new life there. But they're typically cells of that particular tissue which is broken, like say muscular ligament or fascia cells. So the point is what I'm trying to make, that if you didn't manage, very often, this is actually Lillian, my discovery, very often when people don't have sufficient amount of energy in the body doesn't have enough oomph to complete the inflammation, complete this scaffolding, complete the remodeling. So you can be stuck on inflammation, you can be stuck on scar formation, or you can be stuck even at remodeling, so you don't never remodel the scar. So you see, there are so many elements of this. And if you have good understanding of this process, you can help your body to fix that. And there are some physical medicine, I call this physical medicine in my head, because it uses principles of physics, like electrical current in the body, or we can use light on these areas to help the body to heal it and resolve this natural process.
Okay, and what's the third?
The third stage is called remodeling.
Oh, that's the remodeling. Okay.
Yeah, remodeling is when the cells, they basically, like body produce stem cells. I call them teenager cells, because they really decided what they're going to be. I'm going to be nervous cells, or I'm going to be muscle cells. Yes. But with certain input, and typically input happens from your physical sort of oscillation of your energy in the body, electrical energy, give you signal what into you're going to be processed, you're going to turn into specific tissue. So you see, there's so many elements, so many moving parts, and we all can help that.
Well, one of the things that always fascinates me is when I use the frequency, the Avasia, when I use microcurrent, that it tells me where there's an impedance in the body because it sticks there. There's a different flow even on this layer of the skin that is speaking to me. How does red light therapy, how is it similar? How did you use red light therapy to get better, or did you use microcurrent? What kind of journey did you have with frequency? Because to me, there's always a journey with frequency.
I use literally all tools at my disposal. Yes, I use microcurrent. I use my NeuroSteam with biofeedback.
Yes.
So what you're describing, it's a process of biofeedback because the device detects abnormal electrical property on the surface of the skin, and that is prompt the certain frequency to be stimulated. So the electrical current then will be reduced, so you have very gentle stimulation, because if you do too much, you can burn the nerve endings. So that biofeedback really helps. But the light therapy is tremendously good for this, because it's been, since invention of lasers, it's probably 1960s, this low intensity light has been used particularly to resolve tissue problems, to resolve scars, because it remodels a lot quicker. Like the whole collagen remodeling from 3 to collagen 1 happens at a lot faster rate. And in essence, what it's all happening, it's they all create an environment, the best environment for healing. Like with microcurrent, it gives you the physical energy for the cells to use and be attracted, because when you have a broken tissue, the body actually creates the current of injury, and this is like a vortex, and this current of injury is negative by nature. So if you have aids or support with microcurrent, it helps to attract positively charged fibroblast, coming and fixing the problem, those cells, and physically gives energy. And you can use light as well. With light, light works very similar to solar panels. Like solar panels, they have photosensitive stuff, which absorbs photons of light and then converts into electron flow. And the same happened with the body. Light are received by receptors in the body. It's also converts photons into flow of electrons and charges mitochondria, for example, with the red and infrared light.
I had heard of far infrared light, but this was the first time I heard of near infrared light. So there are different kinds of red light therapy, but do they all have the same results? Do they? So I want to introduce the product here is called FlexBeam. And how I found out about FlexBeam, and for those of you who know Dr. John. Dr. John Bergman. That's how I learned. They said they have sold so many of these. He helps his patients with this product as well as his genius expertise. And so because it came from him, I was open to learn more. I've heard of red lights. As a matter of fact, in Orlando, in Brevard County, off of A1A, there is a building that on the fourth floor, one of the doctors there doesn't have any windows or anything. You see this bright red light coming from that room, and people go and just sit in that room. Now, I've never done it, but I know of red light therapy. But let's talk about the FlexBeam and how this right here is different than any of the other red light therapies. So what can you say about that?
So first of all, I just want to explain how FlexBeam came to life, because
Yes.
I was a clinician treating people with this energy modalities with microcurrent, neurostim, photobiomodulation lasers. And then I thought, what we do in the clinic is very, very important. We give energy to patients, but then they're gonna go for the whole week, and I see them a week later in the best scenario, or 2 weeks later. And I wanted for people to have something they can take home and continue that energy input. And so the FlexBeam came to be because of our collective desire, because I found like-minded people, and we created that. And before, what Lillian, you explained, these are called red LED panels.
Mhm.
And red LED panels now become very trendy, because they do help enormously. And it's all came about after NASA started research on plants. And during this research, one of the scientists had a problem with the skin, but they were doing research of using red lights for plants in the hope that it can grow somewhere in this space, yeah. And so when he was working with his hands into red light, he suddenly said, "Oh my God, I heal so quickly. What's going on?" And he wanted to learn more, and that's how studies started to come out of NASA
Wow.
on red lights on all sorts of conditions. And the first, because for plants, what they use panels. And the first, of course, exposure to red light therapy was through these panels,
Mhm.
because what now you could see, especially in biohackers community, you have a panel, it produces lots of red lights, and you supposedly stand in front of panel, receive these healing rays, which energize your body and make you feel good. And but you have to wear goggles and like this. Well, this concept is great because it's kind of give you systemic effect as well. But with FlexBeam, what we've done, because it's a device for people to take home, we've gone one step further. We make it for human beings. So it's on the body. So when you use FlexBeam, this surface is going to be used on the body in skin contact. And when it works, it just gives you stimulation directly in your body. You don't need to wear goggles. You don't need to stand by the panel. You can just stick it on your body around, and you get the stimulation. But of course, we know red light therapy has been around, especially in aesthetics, that it helps collagen, it gives energy to the cells, it improves circulation. We know all this, but you know, if you want therapy, you need specific near-infrared lights, because red lights will be too superficial. Red light is absorbed at the skin level. And like you mentioned about fine infrared lights, Lillian, this is fine infrared light is absorbed primarily by the water in your body. So it's also going to be quite superficial. To get deep in the tissues, you need near infrared. This is a discovery from science. And so when you look at FlexBeam, it produces near infrared light in program 2 and 3. So you can target joints, you can target, you know, sciatica pain, for example, neck muscles, shoulder, even big bodybuilders' shoulders. The light penetrates deep and it delivers that energy. It also improves circulation there. It also stimulates collagen. So if you have inside scars, it helps to remodel it. But generally speaking, what it does, it creates that healing environment. Your body then complete that inflammation process, and injury is resolved completely.
So with and this is amazing. It's amazing because I have the Avasia, and the Avasia can be costly. And not everybody can afford Avasia. But with the FlexBeam, you guys have made it so affordable. And now that there's a wonderful sale going on, I encourage all of you go to whenyouneedafriend.com and check out my Shop Now bag. You're going to find the FlexBeam there. And if you enter my code, not only are you going to get some benefits from going into my website, but you're also going to get an extra $10 off to whatever is going on in the website if you click on it and it takes you to the website. I'm really excited because I've used pulse electromagnetic fields at the PEF machine. I've used microcurrent, Avasia, and now I am using my third. I was like, I love frequency. I am just so excited about it. But what I love about it is the affordability and the flexibility that I can take this product anywhere I want. I can sit in my bed, watch with my husband, watch football, whatever it is, because I normally don't watch football with him, but he knows that when I'm doing this, I just want to be just chill. But I haven't told you this. I've had sleep issues for a long time. And I know that there is a protocol for sleep with the FlexBeam. And what I've been doing is I've been putting it on my abdomen area on level 2, because there's 3 levels, as Dr. Zulia mentioned. And then I put it sideways over my abdomen. And let me tell you, I have been sleeping so well. I usually wake up a lot in the middle of the night, and sometimes I can't get back to sleep. I have been able to sleep the entire night. And I attribute it to the FlexBeam because really nothing else has changed other than this. So can you share a little bit about sleep and what other things that the FlexBeam beam can help with?
It's very interesting you mentioned sleep. You know, I have done actually a case study where I use like a testing subject, like a guy who for 8 years he doesn't sleep, and in the morning he can't wake up. So we took his saliva melatonin level and we measured it because I read in the research that red light therapy stimulates production of melatonin, your own natural
Ah,
melatonin to regulate your circadian rhythm and sleep-wake cycle, but also to help as a good antioxidant and repairs DNA. So I wanted to see what does it do to melatonin? And one of my thoughts was, okay, it may be increased melatonin, but then how is it like he's sleeping in the morning and he's not sleeping at night? Anyway, cutting story short, he did exactly what you explained the protocol over the stomach, but in addition, the next day he was doing over the back of the neck and the low back as a sacrum, and he was putting just across. And within 4 weeks, he was doing this Monday to Friday. Weekends kept off. And 4 weeks he has done. And then we waited just one more week. And I retested and did another melatonin sample. And what was beautiful result? Amazing. I didn't expect that because what happened? It's self-regulated. So melatonin in the morning, which was too much, went all the way down into normal zone, and melatonin at night,
mm,
which was very little, gone up. So he was able to sleep and waking up in the morning refreshed, you know. This is quite remarkable because if you think it's just something which, you know, pumping your melatonin up, no, it works with your body and it
it's
creates
amazing.
regulative process.
Well, that makes sense. That makes a lot of sense because that was one of the first things that I did. I also had a pain in my heel. Remember, I had mentioned to you, and I started putting it on my foot. I did it, whether it's plantar fasciitis, we don't know. I don't know what it is, but I couldn't step on my foot. And I still haven't gone to the doctor because it's manageable, but I'll put on the FlexBeam and just put it around my ankle. And I love how they have little bands. They have little bands or larger bands that comes with this beautiful case. And in here, it has different, so if you live anywhere in the world, they have the light switch for you. So fortunately, they had the USA switch, and I was able to put it on. I think I have it here. I don't know. Okay, hold on a second. It's right here. Oh, here you go. I have it right here. So you can take this off, and it will you can put whatever back, in your walls or whatever. So I know that we have listeners in England and Australia and all over the world. You too can get this, and so I'm really excited about the flexibility of wherever you want to use this. So that also has the bands that come in here, and it's got a beautiful little manual that just right off the get-go, I was able to start using the FlexBeam just by looking at the manual and looking at the different positions. And let me just show you. This is let me see if this is the shoulder one, but let me see if the protocol I was doing is this protocol right here. It's the first one that's on there. And I just wanted to make sure that I started with that because I would say of all the issues that I've experienced in my life, sleep is something that I kind of like put aside. And I say, someday I'll sleep, someday I'll sleep. But that can cause massive stress in the body and it could age our body. And that's not a good thing. At my age, I want to keep my body as young as possible. So I started doing this protocol, and within like that night, I started sleeping the entire night. And I'm going, wow, that was a good night's sleep. So let me do it again. Let me do it again. And one night I didn't do it because I was tired, woke up. So I thought, I wonder because it was too soon, I guess. And so I said, I've been doing this religiously. And now my husband says, haven't you done the flex beam yet? Because he wants to watch more football. I'm like, yeah, okay, I'll do it. I will do it. And so that happened last night. And once again, I had a great night's sleep and I feel refreshed. And let me tell you, Every person. Oh, you need to try melatonin. Oh, you need to try this over-the-counter sleep formula, that sleep formula. I won't even try them anymore because they don't work on me. I needed to work on the root cause. Whatever was causing it, this FlexBeam has worked really well on that. But it also has helped with pain. It also has helped with inflammation. So for people that have inflammation in their body, RA or other lupus or anything that requires, I'm telling you, and it is very affordable. Go check it out at whenyouneedafriend.com. While you're at whenyouneedafriend.com, please subscribe. While there, check out my sponsors. Support my sponsors the way that they are supporting the classroom. Then go and check out my Shop Now bag, and you will find that there is an incredible sale going on right now. I believe it's 25% or 20% off if you buy one, 25% if you buy the Pro membership, and you buy one, get one 50% off. And on top of that, if you put in my name, you get $10 off. So this is a wonderful product, a great gift for health. Also, go check out all the other Shop Now when you go to Shop Now bag. Check out all these other ones too. It is an affiliate page, so it will help the classroom grow a little bit more. But just know that everything, not everything in my Shop Now bag is an affiliate page. I just absolutely love this product, and I just want to share them with you. Last but not least, you can become an enrolled student in the classroom, whether it's $1 or $1,000 a month, a one-time donation, whatever the case might be. Please, sharing this video, sharing it with your friends. If you know someone who has some form of a condition, whatever it is in their body, whether it's Lyme or they can't sleep, like I was having, like I can sleep for like short periods of time, but I could not sleep the whole entire night. It helped me with that. And I am just so forever grateful to Dr. Zulia and her wonderful team that she has, Alessandra, who has coached me through these process as well. It's just been a wonderful experience. So whether it's sharing this video, putting emojis, making a comment, asking questions, I will share your questions with Dr. Zulia. So just check it out. And Dr. Zulia, thank you so much for coming to the classroom today. You could be anywhere else, but you chose to be here today, so thank you so much for that. What can you say about for people that are listening today going, that sounds too good to be true? What are some of the other conditions that you know that red light therapy, far infrared, near infrared has helped with conditions as well?
Well, to start with, when we actually developed the product, first photobiomodulation, and I thought, oh my God, is it gonna work? Because you use Abasia, I use similar technology, other, and I'm thinking there is nothing better than this. So I actually came to be a skeptic first. So I designed actual clinical trial to test, even prove it to myself. So the clinical trial, I just invited, I said, anybody with any kind of pain coming through, and I'm just going to use it exactly 30, 40 minutes, 3 times a week. And let's see what's going to happen for 3 weeks we are allocated time. And, remarkable. I had people with fractures. I had people with neck pain, back pain, the tennis elbow. I had people with sciatica pain. I even had people with slip disc pain. You know how terrible is, like you can't really. I had people who couldn't lift the arm because the shoulder was hurting so much, all this rotator cuff injury. I had people with stomach pain, period pains. I had also people, in addition to that, I had one girl, teenager with very, very severe asthma. And all of them absolutely benefited. And so in the pain score was in average 6 out of 10. By the 3 weeks, end of 3 weeks, it was 1.5 out of 10.
That's
This is
amazing.
75% reduction. Honestly, for device which literally doesn't give you headache, you just put it on the body, it actually feel very pleasant. It doesn't cause like was it's electrical, yes, but this is like feels
Warm.
comforting
It is
and
comfortable,
very
warm.
light sensation,
Hmm.
and it can help you in variety of problems. But I also want to tell you, this is product which is uniquely also work for people who don't have any problems. If you, for example, have a problem, like if you go to the gym, obviously you want to improve your fitness, yes? So this could be the tool which you do as well. You can just put on the muscles which you're going to exercise in the gym. And guess what? When you go there, you pull more, run further, and do stuff more. So your fitness goes a lot faster. Or if you run marathon, you can prepare yourself for running marathon and not so tired with these horrible DOMs afterwards. So yeah, it's a variety. It's very, very good. And in the family, everybody has got some kind of thing. So um, it could be used at home.
I love it. I love it. And it's affordable. Right now, there's a big sale for the holidays. Look into it. Go to whenyouneedafriend.com. If you have any questions for me, you can always reach me at 407-373-5959. But you ship to all over the world, right, Dr. Zulia?
Yes, literally all over the world. And like you mentioned, they come with a certain specific plug for that.
That's right. And do you
Mhm.
have like a money back guarantee if somebody finds that they don't like it?
Is yes, as a company, we so care about our customers. So we really want to make the device so good. So if you use, and maybe you have chronic conditions. So first we were selling at 30 days money guarantee, but then I tell guys the people need to longer to evaluate. If they have chronic condition, it takes a little longer, like 1 month to get results. So now we expand it to 60 days. And the warranty of the device, actually, we went for the actual device, 5-year warranty, because we're very confident you like it. And lots of people buying it. I can see on Trustpilot and people connected to me. Oh, by the way, just 1 minute, I'm going to explain. You mentioned about this. We also now launch a membership program,
Yes.
which has free forum. So you can, once you have the device, you can just log into and you're constantly in contact, not only with me, but other experts who's been using now FlexBeam technology for some few years. You can put your comment, and there are protocols, there are webinars. There is a huge resource of data for you.
I'm so excited about this. And when I say it's affordable, now keep in mind people pay $1,000 for their phones. They pay $1,500 for their phone. A Vazia, a cheaper model could be like maybe 700, maybe 500, not even 5, 750 up to $4,000 because it has so many frequencies. With the FlexBeam, right now I believe it's $100 off. And but I'm not, don't quote me on it because I just we air these classes over again and you might watch it at a different time. But if you're watching it today on December 4th, I know that today they have an incredible sale plus you get $10 off that incredible sale. But you can get this like for $439 is what I understand today. But don't quote me. Just go to whenyouneedafriend.com, click on my Shop Now bag, which you just scroll down, click on the Shop Now bag, and then just click on the actual FlexBeam picture that you get right there. But what I want you to understand is that we spend money on things that really don't matter, especially this holiday season. How much junk are we going to buy just to give a gift? Why not buy a family instead of giving individual gifts? Buy one. And maybe friends can get together and say, okay, let's buy two. Buy you one, buy one. The other one's half price. We'll share the savings together. There's so many ways. And let me tell you, until I understood what frequency was to the body, until I had pain, I didn't realize how fabulous this product would be. And so it was a very easy like I am willing to try it, especially if you get $60, 60 days money back guarantee. So I want to encourage you all to go to whenyouneedafriend.com, check out today my Shop Now bag and start your journey. We've got about 5 minutes left in today's class. Can you believe, did I tell you it was going to go so fast? What can you say to people that are listening today going, I've been told that my pain will never go away. Maybe they have had surgery. Maybe it is scarring that they have that's creating the pain, but no doctor will tell them that. What is your words of wisdom in your training as an MD and as a Chinese medical doctor or Chinese medical of Oriental medicine, acupuncturist, someone who knows frequency and energy? What is your advice to people who are listening today that haven't had the pleasure of dealing with frequency medicine?
Well, first of all, I want to say that I've treated way more than 10,000 patients. And I use this particular method. I use energy medicine. And guess what? I was getting results from almost every case. Everybody can find benefit. So these things do work because it works with the body. My actual plea to you is this: take charge of your recovery. Take the charge of this recovery yourself, because you should not rely on doctors. You should not rely on other even therapists. Yes, you should rely on yourself, because you are the one who is doing this. You need to be disciplined. You need to eat well. You need to rest well. You need to drink clean water and good products. And you need to energize your body, because without energy, the body cannot exist. Cells need energy. So giving your body energy is so important. So overall, I just want you to go ahead and try it, because for every problem, there is a solution. You just need to find it.
And we are the solution. I mean, the God in me made me so creative that any problem that I have, any issue that I have, I know already has a solution. So we need to, or we get to, be our own MD, our own medical detectives, and figure out how we can heal our bodies. And this is like when people get prescribed. This is an ongoing residual income. The pharmacy, the doctors, the companies know that they're going to be hooked and having to buy this medication. Now, when somebody starts doing FlexBeam and starts using far infrared, near infrared, all the and just the red light therapy, is it possible for someone to not need their medication? Is it possible to titrate down with a professional to get off medications?
It's absolutely, absolutely possible. Of course, not for some, not going to be immediate win, but you can work towards it. And you have the devices, you have our advice, so you will get there.
That's good to know. And so, again, what I'm saying is, if you are in pain, I am just so sorry. I am so sorry, because the times that I have experienced pain, I would do anything. It's like I would do anything. I remember just recently I think I mentioned to you I had some muscle spasms in my lower back, found out that I also have herniated discs in the L4 to 7 down. And so I don't know if it's what happens on the top happens on the bottom. I don't know. But we finally found out that I have the herniation down there as well. And at that moment, Avazia, I was doing Avazia. It was the spasming that I just didn't know what to do with. And I could see someone saying, just cut me open, just do whatever you want to take the pain away. And I remember taking some Aleve for the first time in a long time. I've not taken Tylenol, I have not taken anything. And I'm grateful that it was just like for 2 days. But some people are on these medications for a long time. We only have about a couple of minutes left. Let's talk about the side effects of medications in the body. If somebody's been on medications for a long time, can red light still help them?
Yes, but you will encounter first detox reactions, because remember, whenever you put any chemicals in the body, it has to be processed, it has to be broken down in the liver. And as it's happening, your liver gets scars inside and then eliminated through your kidneys out of the body. So
Okay.
every medication, regardless how wonderful and beautiful it is, it's going to give you at least some kind of trace of side effects. In the best scenario, there will be minimal effects, but in the worst scenario, could be everything from constipation to, impotence and all sorts of things. So really, I would start, even if you take medication, start gently to use FlexBeam, and then gradually you win yourself over that. In my research, when I did lots of case studies, we saw people doing this and getting themselves off medication completely. So it's possible.
Yes, yes. And just know this too shall pass. I am so grateful to you, Dr. Zulia, for introducing me to the FlexBeam. Actually, Dr. Bergman and Kat for introducing me to you and facilitating this conversation as well. Life-changing, all of you. I would not put my name behind this if I didn't believe in it. And I know that you will experience, just give it a try. Try it 60 days, but return the product. You got to return the product if you decide you don't want it, but I promise you, you're going to want to keep it. It is a great investment for your health and a great investment for your family, for your life. And so I can't say enough about it. So thank you, Dr. Zulia, for your journey. I'm sorry that you had your journey the way it did, but it led to so much more passion and love in the world because you do what you do. So thank you so much.
Thank you, Lillian. Thank you very, very much.
Yes.
Appreciate it.
Yes. Okay, go to whenyouneedafriend.com, check it out, and see if this is something that's good for you. And please remember, I'll be right here waiting for you worldwide at whenyouneedafriend.com. This is Lillian McDermott and Dr. Zulia Frost wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. Good job. All the way from Spain. Good job.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking any steps to improve your life.